Welcome back, EDU 300 Human Growth and Development students, to Chapter 2, Week 2, Module 2 of this course. This week we're going to be talking about biological beginnings, and I will tell you that when I was making our short lecture for today, I deleted a lot of chunks of some more of the science concepts that I felt the textbook would do a much better job communicating to you guys. So please don't take this lecture as a complete guide to the chapter. I just wanted to hit on some of the highlights that I think would be important for you all in the classroom. So as we get going here, as you are listening to this lecture, keep in the back of your mind that our discussion for this week is for you to explain some of the ways that heredity and environment interact to produce individual differences in development that could be seen in your future classrooms. So as we talk about all of these things, think about, how will this affect each one of my students that come into my classroom door? You can see we are going to kind of talk about this evolutionary perspective. That's going to be on some quizzes, so take note of that. Genetic foundations of development, that's part of the part that we're skipping a little bit, so make sure you're reading your text really well on that. Some heredity and environment correlation, prenatal development, birth, and then the postpartum period. So let's jump right into it. You can see that this evolutionary perspective is one theory that science can discuss, and it's the natural selection and adaptive behavior, and it is often known and has been developed as evolutionary psychology. It's the idea that natural selection and adaptive behavior, the natural selection, of course, is that evolutionary process by which individuals are best adapted, and then therefore they survive and reproduce. And adaptive behavior promotes an organism's survival in their natural habitat. As we are moving along here, of course, Darwin introduced evolutionary psychology in roughly 1859, and that is the idea of theory evolution. This is studied by some, this evolutionary psychology, to understand human development a little bit more. And of course, one concept is that humans have a longer childhood to develop a larger brain and learn our complexity of social systems. When we look at the collaborative gene, we can see that genetic influences on behavior evolved over time. And our traits have a long line that can be traced back into our DNA. And the textbook gives a lot of info about gene-linked abnormalities that you're going to want to look into, but I was not going just to read them off to you. So make sure in your text that you look those over a good deal. Make sure you're reading that, taking notes, and using your Connect SmartBook app to make sure that you are really diving into those. We are skipping to prenatal development, and this is going to help us describe prenatal development, the course of prenatal development, and then we're going to talk about some hazards that the mother can see while she's pregnant, and of course prenatal care. Something that we need to understand is that conception occurs when a single sperm cell unites with the egg in the female's fallopian tubes, and this is creating a new individual, and it will take roughly 266 days to completely fully form. And you can see in your textbook, and we're going to talk about that there's kind of 3 stages or periods when we are in prenatal development. There's the germinal, embryonic, and fetal. So first let's look at this germinal period. Of course, it is the first 2 weeks after conception, and if you pause this, you can look and kind of follow the path here through all of the steps, and I highly encourage you to do that. I am by no means going to read those to you, but it is just interesting and a really great graphic. Our second period here is the embryonic period, and it occurs 2 to 8 weeks after conception. The rate of cell differentiation intensifies, and so a lot of stuff is going on during these first 2 to 8 weeks. That's very exciting. Support systems for cells form and organs begin to develop. And this mass of cells is now called an embryo. As we are looking on, we can see some of those life support systems that they were talking about that's being developed during this time, like the umbilical cord, the placenta, and these develop, which is kind of interesting. The umbilical cord develops from the fertilized egg and not the mother's body. And then at the very bottom of that slide, you can see that period 3 is the fetal period, and that is 7-month period between 2 months after conception and birth. And you can see right here a pretty good graphic about the placenta and the umbilical cord. I would again encourage you to pause this video and take a better look at that. When we are talking about the first 3 trimesters of pregnancy, we can see the first trimester, it's the first three months. It's conception up to 4 weeks. We have it's called a zygote at this point, and it is less than 1/10 inch long. We then move into 8 weeks. It's just over 1 inch long, called an embryo. 12 weeks, at this point we call it a fetus. And during our second trimester, those are kind of those middle 3 months. You can see a lot of things are forming and changing. During the 20 weeks, you can see certain things are happening, like hiccups and hair and eyelashes. At 24 weeks, eyes are opening, they have a strong grip, and in the 3rd trimester, the last 3 months, the baby is about 16 inches long and weighs about 3 pounds. At this time, it's constantly adding body fat, very active. As we continue here, we can see into the 3rd trimester. At 32 weeks, things are happening. The baby may assume the birth position, getting ready. 36 to 38 weeks, the child suddenly becomes a little bit less active because big things are about to happen, and the baby can sense that. You can see the 3 trimesters of prenatal development. To me, this is very helpful as a graphic, and so again, I would kind of pause that and look at that. One of your observations, or your only observation this week, is to watch a linked YouTube video, and you can see kind of the how the baby will evolve through all 3 of these trimesters. And I'm going to want you to choose 1 week in particular and link a video in the discussion board saying, okay, I thought that week 5 was really interesting. And so I went in and I found a video telling us more about week 5. The baby is in the embryo. So that's just something for you to be thinking about. When we talk about prenatal care, prenatal diagnostic tests are really important. You will, with the doctor, or the mother with the doctor, will decide how far into this prenatal testing that you would like to venture. Because there are several tests that are available, and you do not have to do any of them. You might want to do all of them. A lot of times this is decided with the mother and the doctor based on the mother's age, the medical risks that might be present, and any genetic factors that can contribute to maybe a high-risk pregnancy. Recent advances have opened more choices for infertility. 10 to 15% of couples in the U.S. experience the inability to conceive after trying for 12 months. And when I say that, I mean participating in intercourse without contraception. And so that's about 10 to 15% of couples in the US are experiencing this infertility and might try with IVF. Another option that the textbook mentions, and I wanted to make sure that I kept in here, was of course adoption is another response to infertility. It's a social and legal process that establishes parent-child relationships between persons unrelated at birth. I've never seen a definition like that for adoption, but that is very true. Adoption is very beneficial for a child rather than staying in a foster care system their whole entire life. Children who are adopted at a very early age are more likely to have positive outcomes. Okay, so when we are talking about a woman during pregnancy, there are a lot of things that can cause birth defects or negatively alter cognitive and behavioral development. And so that teratology is something that you're going to need to know for quizzes, and it's the study of the cause of birth defects. And it goes into a lot of different reasons why there might be birth defects. Drugs could be present while a woman is pregnant, incomparable blood types between two partners, environmental pollutants, infectious diseases, nutritional deficiencies, stress in the life of the mother, age of parents, and environmental pollutants. All of those things can go into things that could contribute to birth defects. When I look at certain things that could be harmful, and when we look at specifically drugs, there are certain prescription drugs that can cause birth defects. There are some antibiotics, antidepressants. There are some acne medications that you cannot use while you're pregnant. Of course, oral contraceptives, diet pills, aspirin in high doses, a lot of things that sometimes people don't think about. Caffeine, of course, cocaine and marijuana and heroin can cause huge effects in the life of a child if they are used while the mother is pregnant. Of course, alcohol and nicotine. Try to avoid both when a woman is pregnant. And then it goes a little bit more into those incomparable blood types between the mother and the father. That can happen. Environmental hazards, radiation, toxic waste, and other chemical pollutants. You might think that this is the United States. Those things do not happen, and that is completely untrue. There are areas of our country that mothers are experiencing these. And then there could be diseases that the mother contracts during her time being pregnant or before that can prove to be harmful to baby. And then, of course, there's other parental factors. The mother's diet and nutrition, if she is obese, her age, if she is too old. And then, of course, emotional states. If there's a lot of fear and anxiety, if there is stress or depression, or it's just a really intense time in the mother's life, that can have negative effects on the baby. And this is another graphic that I left in here that if I were you, I would totally pause and just look at it a little bit because it is very informative. When we are looking at prenatal care, usually it's scheduled visits to the doctor, and these will include screenings and then services for educating the mother, social services, nutrition services. A lot of these things can be very helpful to new moms or young moms. I definitely took all of those services seriously. Okay, and so when we are talking about the birth, this typically happens in 3 stages. It is a process. The 3 stages of birth, the first one is the longest. This is where contractions are happening and the woman's cervix is stretching and opening. And by the end of the contractions, she has dilated her cervix to 10 centimeters, which is 4 inches. I urge you, go measure what that is. Our second stage, contractions are continuing, and with each, the mother is bearing down to push out the baby. And then, of course, we have the third stage, and you are not finished at this point once the baby is delivered, because you still have to deliver the afterbirth. And that is important that that happens to make sure that the mother does not experience some toxic issues after the birth process. We can see some facts here. In the United States, 98.5% of births take place in hospitals. You can see that 63% are at home, 31% are at birthing centers. And that is of the 1.5 outside of the hospitals. Midwives are at 8% of hospital births. There is also someone called like a doula, and that is someone that's giving you care for the whole person during the whole service. And then there are different methods of childbirth. Of course, you can have medication. There is natural childbirth, and that is reduces mother's pain. You're going to do that through educating yourself about exactly the process and different things that you can do to reduce the pain, not through medication. There's prepared childbirth, and there is the Lamaze method, and I will tell you through experience lots of other different methods that can be used. And then, of course, cesarean delivery, and that is when the baby is surgically removed from the mother's uterus through the abdomen. Now, when the baby is born, we are going to assess the baby. They are assessed on an APGAR scale, and we are measuring things like the infant's heart rate, respiratory effect, muscle tone, body color, and reflex irritability. Low APGAR scores are associated with long-term educational support, ADHD, developmental risks, and you can see right here kind of the rubric for exactly what they're looking for. But this is done immediately after birth just to assess the child to make sure that they are safe and healthy. One of the things that the text talks about is preterm and small for date infants, and this is just the idea that low birth weight infants typically weighs less than 5.5 pounds at birth. Very low is 3.5, and extremely low is 2 pounds or less. Preterm is the idea that a baby is born before the completion of the 37 weeks of gestation. A lot of times you hear 40, but 37 is what we're at least trying to get to. And all of these things can have a high impact on a child. For preterm and low birth weight babies, a lot of times high poverty countries will have, who have poor health, will have a percentage of low birth rates, and that can be as high as 31%. And a lot of times this high poverty, low health of the mother and the communities help attribute to that low birth rate. In the U.S., we actually have had an increase in low birth weight over the past 2 decades, and we're up to about 9.6% of babies having a lower birth rate that we would like to. And in many European countries, they're running at about 4 or 5%. But things that can help with this is kangaroo care, which is skin-to-skin contact between mother and father and the baby. This has a lot of benefits, and of course massage therapy can help increase infant weight, reduce stress, and reduce hospital stay. Bonding is very important, and this actually used to be particularly bad at U.S. hospitals, allowing this because a lot of times they would separate mother and baby immediately to have the mom rest and recover and recoup, and they would actually keep the babies in a nursery in a whole different room. That is not best practice anymore, and after a woman has a baby, typically they are kept with that child as much as possible to create that bonding. And it is just as important for male and female at this point with the child. After the baby is born, we're entering a postpartum period. And this can last about 6 weeks after birth, and it is when the mom is adjusting physically and emotionally from childbirth while also bonding with the child. The postpartum period lasts until the mother's body has completely adjusted and returned to a nearly pre-pregnant state, and it takes a lot longer than you would think. And again, we're looking at physically, emotionally, and psychologically. You can see that physical adjustments, fatigue is very common, especially because you are sleeping a lot less. There's hormone changes. Emotionally and psychologically, postpartum depression is fairly common. And it's the idea of it's difficult to cope with daily tasks in this postpartum period. And you can see some stats on that on your screen if you would like to pause and look over those. The last little graphic that they put up here is the postpartum blues and postpartum depression among U.S. women. I put this up here just to show how common it is, so you can look at that graph and check that out. Again, so some things that I want you guys to think about is every student that comes in your classroom at one point went through this process, I can guarantee it. They were an embryo, they were a baby in their mother's womb, they were born in a process that might have been very traumatic. It might have been a natural childbirth. All of these things, the bonding with their parents, all of these things go into the idea of who the human is when they come into your classroom. And so I really want you to think about in your discussion for your reflection for this chapter to think about ways that heredity and environment and this birthing process has developed the tiny human that's coming into your classroom and how that will affect your classroom. I hope this has been informative and not too long, and it pairs well with the rest of the assignments. If you guys have any questions, please let me know and I would be happy to answer.